Hi, my name's Sarah and welcome to our Wellness Series session on bone health. Here's what we'll be covering today: how cancer treatment impacts bone health, common risk factors, ways to build and maintain strong bones, and how exercise can play a key role in prevention and recovery. Certain cancer treatments, especially for breast and prostate cancer, can reduce bone density and increase the risk of fractures. Chemotherapy, hormone therapy, or surgery to remove the ovaries may lead to early menopause in women, which lowers estrogen levels and affects bone strength. Hormone therapy in prostate cancer reduces testosterone, which also weakens bones. If you're at risk, your GP or oncologist can provide a referral for your bone density scan to check for osteoporosis. Osteoporosis is the name of the condition where your bones become weaker and more fragile, which means that they can break more easily. Healthy bones are strong and have a dense outer layer and a firm inner structure that looks a bit like a honeycomb. With osteoporosis, this inner structure starts to thin out and develop bigger spaces within that honeycomb-like structure. This makes the bones less sturdy and more likely to fracture, even from a small bump or fall. There are several factors that can increase your risk of developing low bone density or osteoporosis. These include receiving chemotherapy or hormone therapy, having a family history of osteoporosis, low body weight or BMI, poor dietary intake, and lifestyle habits such as smoking or regularly drinking more than the recommended amount of alcohol. Certain medical conditions can also contribute. Understanding your risk is the first step in protecting your bone health. So what are some strategies for building healthy bones? To build and maintain strong bones, focus on 3 key areas: exercise, a calcium-rich diet, and medication if needed. Calcium is essential. About 99% of the calcium in our body is stored in our bones. If your diet lacks calcium, your body will draw it from your bones. This weakens them over time. Adults should be aiming for at least 1,000 milligrams of calcium every day. Good sources of calcium include things like dairy, leafy greens, seafood, nuts, and some fruits. If needed, supplements can also help, especially when combined with vitamin D, which helps our body to absorb calcium. Sometimes your doctor may recommend medications like biphosphonates. These help slow bone loss, strengthen bones, reduce fracture risk, and manage bone pain. They can also help correct high calcium levels within the blood. Your care team will guide you on whether this is an appropriate treatment for you. Exercise is one of the best ways to keep your bones strong, but not all types of exercise will help your bones. The best exercise to help with your bone health are the ones that make you move against gravity, things like walking, lifting weights, or doing balance activities. These exercises help build stronger bones and muscles, keep you steady on your feet, and lower your risk of falling. It's important with exercise to start slowly and do what feels comfortable. Try to be active regularly, and before starting any new exercise or exercise regime, make sure you speak to your doctor and make sure that it's safe for you. So to wrap it up, maintaining bone health is possible with the right strategies. A calcium-rich diet, regular weight bearing and resistance exercise, and medical support where needed can all help. If you're not sure if you are at risk, ask your GP or specialist. And remember, support is available through your care team and resources like iconcancercentre.com.au.